and wants to have breast work. And we calculate all the skin excess, everything, we put in a breast implant, whatever. Finally, the patient sees the mirror and say, I like the result, I like the volume, perfect. But I'm still overweight. But I feel so good that I'm going to try to lose weight. And the patient loses weight. But remember that some part of the volume of the breast is fat. Then the breast is going to be a little bit down, you know, and the fullness is going to be down also. That's why if the patient is more close to the best weight he can feel, the last of the result is going to be more, you know, because it's more close. The patient don't need to lose more weight. It's a weight that normally all the life he has been weighing that weight, no problem. It's the only thing we all advise to patients to do that.
And weight loss surgery patients, removing the skin on weight loss surgery patients, should that be staged? Should that be done when weight loss surgery patients, when we have these big people, the 500-pounders, should some of the skin be removed when they've lost the first 150 and then do a second one when they're lower?
Every case is different, you know, because there are some patients that do not have down the breast, just no volume, and that's it. That patient can still lose more weight, but they don't have already volume to lose. I mean, you put in a breast implant, you don't need to cut the skin, and that's it. But the majority of the patient coming from the surgery or weight loss, the main problem, they have a lot of skin excess, and we have to deal with them, you know. The breast, they already don't have any volume, just skin. We can handle. We can put a breast implant, we can cut the skin, we can tie, and perhaps the patient is still losing weight, it will not affect too much because they don't have too volume already, only the breast implant, you know. Every patient is different, but the main thing related with that patient that has been losing a lot of weight is the skin excess. And we need to cut the skin and tie the skin as much as we can. Face is different, for example. I have been seeing these years that when you make the patient is start to losing weight and is a little bit hanging, and you make the facelift and it's still losing weight, it looks better with the time. It's the only thing. Otherwise, all the part of the bodies is better just to wait as more close they can be at the best weight they can reach.
Oh, okay. I didn't know what you were doing. Dermatology. What can we tell people about what your wife offers as far as dermatology? How could
well, we have different lasers to treat some disease of the skin, to improve the quality of the skin. We have some peelings, chemical peelings also, that can help the skin of the patients. We have also the toxin, botulinum toxin, like Botox or Dysport or whatever that we can put in here. I can do it, my wife also can do it. But also is orientation that the dermatologist can teach to the patient to use some kind of creams, the order of the creams, and that can also to improve the skin. We also have lasers that can use for veins of the legs, spider veins and everything, and we offer that also.
You know, it's been something that we haven't really explored, and we need
to. So one thing is good, like you tell us all different, you know, type of plastic surgeries that you offer, you know, from, like you said, you know, breast to hair, you know.
We feel very good about the majority of the surgeries we perform. I feel I'm a well-trained plastic surgeon. I do hair because I like it, and you need to invest in people and also in the facilities to do and can perform this kind of surgery. I have been experienced with a lot of post-bariatric surgery for 10 years, and these are different patients. You have to be very close to them to check all the metabolism state of the patients, just to know how much skin you can take it, how much procedure at the same time you can take it. I mean, some patients, they want to do everything at the same time, but sometimes it's not too good. Why? For health of the patient, for security of the patient. Then it's very important to explain them, and they can understand that this is for best for him, for the patient. And I feel comfortable of all the surgeries related with the lost weight surgery, and also the aesthetic surgery. I don't perform more reconstructive surgery. The only breast reconstructive surgery I still perform, but other kind of surgery, I only do aesthetics. Breast, face. I do a lot of face, eyelids. Last week, I went to Mexico City to give a special lecture for all nation about eyelid surgery. The second year they invite me to national lecture, and they recognize me like people that can perform this well. And we have a full practice of patients. We have all days we have surgery. All the time we are working with that. I did like an MBA business also, and we know to deal with people. We did like a company, and to give patients security, feel comfortable, and also like this is in a company. It's not just a doctor. We spend a lot of money to have a good operating room, to have everything update, good personal nurturing, everything. We have a personal people is working with me. We have people just taking care about the finances and everything. This is a professional clinic, a small one, but we're working well. I mean, we don't have any complication. Big complication. I mean, we can have, because in every patient the wound can open a little bit, whatever, or seroma. I mean, only the person that don't make any surgery don't have complication, but we don't have never a big, huge complication, never. Why? Because very close to the patient, we select the patient, and we perform just what we feel comfortable. We can do it. We can do with the patient, based in the health state of the patient at that moment.